Good morning and good afternoon to you all. I am Virginie Bohl. I am the coordinator of the IMPACCT working group, and I'm pleased to be here today to present the work we are doing within this initiative. The IMPACCT working group was created at the Humanitarian Networks and Partnerships Week that is organized and convened by OCHA and by the government of Switzerland. And the IMPACCT working group was created under my initiative and leadership in 2017. It represents a network of strategic partners, such as the World Customs Organization, UNCTAD, Help Logistics, the World Bank, IFRC, Save the Children, MSF, etc. And we are looking at how to address the delays in the importation and customs processes for emergency relief items and all the problems that are linked to that. We work together and we develop a collective and coordinated approach, and we also develop tools to support national coordination mechanisms and regional coordination mechanisms that relates to the importation and processes for disaster relief equipment. So our main objectives are, first of all, to look at the policy level and to advocate for the ratification of international conventions of the World Customs Organization, but also other instruments such as the Temporary Convention on the Importation of Telecommunication Equipment. We also advocate for clear customs procedures in times of emergency. It's not always easy to understand what the processes are. So we try to develop these type of activities to make sure that in times of disaster, the humanitarian partners do have the relevant information on procedures. We also support humanitarian partners and customs administrations in trainings. We have just launched an e-learning on customs processes for logisticians, and we explain what the different processes are and how to deal with the different challenges they have. When I was working with OCHA since until December 2020, we were looking at how to coordinate all these activities at the national level and regional level. And we continue this work with IMPACCT by looking at how to strengthen the different a relationship between all the actors that are involved in the importation of goods. And as you know, it's not only customs, but there are a lot of partners such as ministries of health and other regulatory agencies that should coordinate their work to enhance the different processes. And then we also work with UNCTAD, and UNCTAD is a member as well of the IMPACCT working group, and they have developed and implemented in many countries the ASICUDA system, the automated system for customs data. And we have developed a module called ASIREC, automated system for relief consignment, that we also implement in different countries. So our work is mainly focusing on preparedness measures. And as I have mentioned, the first measure to take is to make sure that customs administrations and other agencies have ratified the internationally recommended measures included in the international conventions. Then these conventions need to be translated into the national law. And we work with IFRC, the International Federation of Red Cross and Red Crescent movement, to make sure that the legal framework is in place at the national level. Once this legal framework is in place, then we work on standard operating procedures, and we need to translate these legal terms into operational processes to make sure that it can be used by any humanitarian organization that want to import this good. As I have mentioned, we also work on the national and regional coordination. We also run simulation exercise to test the SOPs. So then we make sure that all the national stakeholders are involved in this simulation exercise to test all the procedures as a preparedness measure to an emergency. We also provide a training, as I have mentioned already, the use of information technology, as I have mentioned with UNCTAD, and we also develop mechanisms to share data and information in case of emergency, so that when an emergency happens, then we are ready and the government is ready to reply. And then we have lessons learned, and then we start the process again, and we look at whether the international conventions are okay or should be amended, which is the case today with the World Customs Organization and the revised Kyoto Convention. Its specific Annex J5 on relief consignments needs to be updated. So we are working on that and providing inputs to the member states of the World Customs Organization so that they can take into consideration our needs and the needs of the humanitarian community. So this is the overall presentation of the IMPACCT working group. But with the COVID and the challenges to import medicines and medical equipment, not necessarily vaccines, because they are dealt with governments directly, but there is still a need to look at the challenges to import medicines and medical equipment during disease outbreak. So we have created a sub-working group to address the main constraints to import these goods, being PPEs, being medical equipment, or whatever equipment is needed during an emergency and a disease outbreak. And then we are we have identified the main constraints that I will come back on it later. We have selected the priority countries, and we have decided that our priority countries will be the countries that have a humanitarian response plan in place. And we have also developed a survey, and I will come back to that later. We have a lot of partners that are part of the IMPACCT working group, but we have others that have joined this initiative, such as GS1, Humlog, and others. And I would like to give the floor to Mrs. Sophie Molle from the GS1 Healthcare to explain to us why did she join this initiative. So please, Mrs. Molle, over to you.
Thank you so much, Virginie, for having me with you today. Basically, GS1, I mean, the work of GS1 in the humanitarian landscape is not new. But when I first met Virginie, and that was in 2019 in Geneva, the Humanitarian Partnership Network Week, I thought we need as a key role for us to play, and we need to be more active than we were in the past. So basically, when this sub-working group on the importation of medicine and medical equipment has been created, I, let's say, raise my hand and say, thanks to my background at the World Customs Organization, because I spent a couple of years over there in charge of the fight against counterfeiting program, I really wanted to have GS1 sitting at the table. For those who do not know GS1 is an international development standard organization. We're operating in different sectors and worldwide. Basically, we have a headquarters in Brussels and Princeton, and we have 115 member organizations globally in a lot of countries. We're operating in different sectors, in retail, in food and beverage, in technical industries, transport and logistics, and of course healthcare. And I'm working there. So why the GS1 healthcare and GS1 global system of standards would be interested for this humanitarian landscape, you would ask me. Basically, we do have a global system of standards. We are around 3 pillars, around the identification of product, the capturing of this information, and the share. And all this system of standards is interoperable and bringing the traceability of products, meaning that it can help the identification of product. You have a unique identification of product in pharmaceutical products, in medical devices, and it fits completely the purpose of the work that IMPACCT is doing. We would be at the last mile. We will operate at the very end of the supply chain, but this is about really helping the traceability of products from a hand-to-end perspective, meaning that with this unique identification of product, we will be able to decrease the counterfeiting, we will be able to improve the supply chain efficiency, and especially in Africa, because this is really challenge nowadays, and ultimately patient safety, of course, and bringing the care to the populations which are needed that, and above that, complying with regulations. I thought that it was really key that GS1 sit at the table with the relevant stakeholders, and even if this is really maybe getting this barcode on the product being scanned by a customs officer at the frontier in order for the process to be smoother and faster, which is needed in the humanitarian landscape, understanding all the journey and all the constraints of the humanitarian actors are really key for us to be able to bring the relevant standards maybe at the end, or to support all this initiative. We, as GS1, were intervening in other panels, and there are other presentations of us during this Pharma Logistics Africa conference. And this is key for us because there's a lot happening in Africa for the moment. There's a lot of regulation, traceability initiatives that are popping up, and all of these creating the collaboration and the cooperation between different actors will lead the way and will help ultimately, of course, as well the humanitarian sector. So yeah, in a nutshell, maybe in a very long explanation, that's the reason why GS1 Healthcare sit at the table, and understanding, of course, all the constraints is key. And I think Virginie will go in a little bit deeper of all of that now. Thank you so much.
Thank you very much, Sophie, for joining and for explaining why you joined this initiative. And we are very happy to have you on board with the other key partners. So as Sophie mentioned, the very initial step that we have undertaken within this working group is to identify the different constraints that humanitarian health partners do face when they import medicines and medical equipment. So we have identified three types of constraints: one, pre-arrival, on arrival, and post-arrival. So you have here on the list, on the screen, sorry, the 15 constraints that has been identified by all the health partners that I'm not going to read in detail, but I'll let you have a look at it. Then you have the second slide on this with, I was mentioning, for example, earlier on SOPs, for example, then you can see that the number 7 here on the screen relates to that, but you have several others that are really challenges for humanitarian partners. On arrival, you also have some constraints that have been identified, and also post-arrival, you have different constraints that have been identified. So out of these 15 constraints, we have asked, the next steps after identifying these constraints, we have decided to share a survey with all our partners and humanitarian health partners to identify the 5 most challenges that they face out of the 15 constraints that I have mentioned in the countries where they operate. So we are currently making an analysis of the result of the survey, and it will be shared with the different stakeholders. We are also going to implement the roadmap that has been decided at the global meeting that was held on the 7th and 9th of December with the World Customs Organization Regional Office for East and Southern Africa, with the African Union Commission, with GS1, and with the members of the IMPACCT working group. The next steps, thanks to the support of Humlog, a university in Finland, we will make a mapping of the end-to-end process to import medicines and medical equipment in several countries that are in the list of those that have a humanitarian response plans in the world. We are also, based on that, we will map the best practices and lessons learned. And the final objective of this group is to develop guidelines for humanitarian operators that will be presented at the Humanitarian Networks and Partnerships Week in May 2022, remotely or in Geneva, depending on what we decide for this next conference. So thank you very much for listening. Thank you again to Mrs. Sophie Molle for joining us today. If you need any more information, my contact details are in the next slides. And I would like to thank again GRV for inviting us to this interesting conference for Africa. And if you have any questions or anything, I'm happy to answer to you. And please use my email to contact me when and as needed. Thank you very much, and I wish you a good day.